So, hi guys. Hope I'm audible. Yeah. So today I'll be presenting the DrugWatch dashboard, a prescription drug cost intelligence visualization tool designed to analyze Medicare Part D spending and insurance plan pricing across five major medications like Ozempic, Trulicity, Jardiance, Eliquis, and Xarelto. These are related to weight loss, diabetes, and cardiovascular care. My dashboard addresses a critical issue in healthcare, like the significant variation in prescription drug costs across different insurance plans, geographical regions, and the payers. By visualizing this data, I think we aim to provide insights into how patients can make informed decisions about the prescription coverage or the spending. This data is derived from the CMS Medicare Part D drug plan, which is provided by the government in its website. So before hopping on to that, let's see some financial terms. As you can see here, CAGR. CAGR is something called a compound annual growth rate. This means the annual growth rate of an investment over like a specific period of time longer than 1 year. You can see in this dashboard, it measures the annual growth rate of drug from 2019 all the way to 2023. Uh, MOOP. MOOP is something like the maximum out of pocket a beneficiary will pay for covered services in a plan duration of a 1 year. After reaching its limit, the plan pays 100% of the covered services. Premium is something the monthly payment required to maintain the minimum insurance coverage. And cost per claim is something like, how can I explain? Yeah, the average cost paid per prescription claim. This includes both the insurer's payment and patient's out-of-pocket cost. So by keeping this in mind, let's hop onto the dashboard. The dashboard consists of nine interactive visualizations organized in three rows for better visibility, all interconnected to a state management system, which means when you click any of the part or any of the element in present chart, everything automatically updates based on the data provided. As you can see, at the top, you can select different drugs, which allows you to switch between different five medications. These four are the performance indicators showing cost per claim, total spending, beneficiary count, and 5 year compound annual growth rate. This shows how much percent it is like developed in the 5 years from like 2019 to 2023, the percentage of increase for different drugs, as you can see. Yeah. So the data sources, as I said, is the Medicare Part D CMS for public use files, and we consider these private plans for right now. So let's come to the visualization. This is the US cost map. This choropleth map shows cost per claim by state using a sequential color scale. As you already know, higher the intensity of the color is something related to higher cost, and the lower the intensity of the color, lower cost of the state region. We can also select different parts or select individual states like New York, Pennsylvania, Ohio, and we can see the things changing according to the state. Also, I've implemented something like by regions, where the South region, West region, Midwest, Northeast regions, South region, um, which we can analyze as a whole. This is the spending stream. The stream graph displays total spending trends from 2019 to 2023 across all five drugs. The width of each stream, as I would say, represents the spending magnitude. You can click on any stream, say Eliquis, uh, and see the data related to the drug and see how much the width has increased. That means how the magnitude has increased over the past 5 years or the 5 years present in the chart. Eliquis being the highest increase thing, and yeah, Eliquis is the most spent drug, the money Medicare has spent most of the money on it. Oh, so many people having cost. Oh, but yeah. So the drug profiles, like you can also visualize another things for everything. And coming to the parallel coordinates plot, the parallel coordinates plot allows you to compare drugs across 5 dimensions simultaneously, like cost per claim, beneficiary spending, CAGR, and compare to other countries like US and the United Kingdom. You can brush on any axis to filter, I would say, and see individual representations. And this is one of the best one, the bench insurance plan. This is one of the most patient-centered thing built in the dashboard and one of the most valuable things, which saves a lot of money and without getting scammed. So this bar chart like shows the annual cost for each of the insurance plans. For Ozempic, Kaiser is the best one, and like the you pay just you save $271 per year. Also, how can I explain? Yeah. So this actually uses the real cost and real data provided from data. So we can use this data to claim that Kaiser is the lowest, I mean, the best affordable method to get this medication. So this is something like you pay out of your pocket, like a copay, when an insurance provider already provides you for the medication. If you take an Ozempic today from the pharmacy, copay is something you pay like $30 or $40 when insurance provider pays for like $1,000. So when the drug is around like $1,500, the insurance guy pays $1,300 and you pay $200. And in that method, the copay, overall copay, as you can say, is less for Kaiser. City, WellCare, CVS can be compared in the same way. So yeah, make sure of this. You see this if you have any of this, okay? So this, what will I pay? In and like a more lollipop kind of thing, which even analyzes more and shows better view. This is the best US plan. I mean, Kaiser is the best US plan accordingly. It shows how much we spend. This is the national average, like considering everything. The worst US plan is the WellCare shown here. The Medicare average is the most expensive one. I don't know why the government is giving expensive ones and the private ones are giving low costs. But yeah, I even also found that private companies like this tie up with the what they call the manufacturers directly so that they can get it for wholesale. This is what I found through Google and analyzing all this data. And we can also like see what Canada and UK are doing. They provide for much less. We should like learn from them. And maybe like the Department of Health can focus on reducing the cost for medication so people can afford it more generously. So this is the trend for Ozempic scene. $10 billion. Oh my God. This $10 billion is something they spend annually in North Carolina. Oh, that's a lot. So the next one coming is the spending share of the donut chart. The donut chart shows each drug share of Medicare Part D spending in the selected region. Eliquis, an anticoagulant, account for almost 37% of total spending nationally because it has both high utilization and high cost. Uh, the percentages change according to the drug you choose, and also the visualization changes accordingly for you to compare easily beside. And the spending tree map, this visualization visualizes drug spending by region, excluding national data to show regional breakdowns. You see the region breakdowns are like present everywhere, like the West, Midwest, Northeast, and everything. Simultaneously, also, this reveals that the South region for Eliquis has the highest overall spending due to its large beneficiary population. Also, you can see it's like way darker than other things. Ozempic. Ozempic. So you see, the north, the midwest, and the northeast, and the midwest, kind of a darker. So yeah, coming to the bubble scatter plot. Scatter plot of the bubble compare cost per claim against beneficiaries with bubble size representing the total spending. This visualization helps identify drugs that are both expensive and widely used. They also represent the highest cost burden on the system. Mhm. And like Eliquis, Ozempic, Trulicity appear more frequently. Uh, oh, these are both costly, man. Trulicity is costly. Eliquis, that's fine. Eliquis has a much higher usage, so you can see even the graph magnitude has been increased in the stream. The spending has also been increased, and the percentage of spending is like more compared. Oh, they should reduce the cost really. And coming to the the scatter plot matrix provides a multidimensional view of drug profiles across cost per claim, beneficiaries, and CAGR, as we discussed what the meanings are. Each off-diagonal cell shows a scatter plot comparing two dimensions, like cost per claim and beneficiaries. You can check each individual dots for further analysis. This allows you to identify correlations. Uh, for example, mm, drugs with high CAGR tend to have high cost per claim. Yeah. So I would say the key insights and methodologies like we have the regional variation. Insurance plan selection matters for everyone who's gonna take the drug. Also, this really helps the people who are like realistically selecting an insurance plan if they have diabetes and they want the plan to cover most of them without getting more out of their pockets and to save. This also like compares international research disparities for analysts and researchers in order to track the spending and see where they could save and reduce the burden to the customers. This can be used for even the customers, analysts, researchers, or even the person who is manufacturing the drugs to uh, keep their spending on where to advertise the drug, so on. So, in conclusion, I want to say is the DrugWatch dashboards provide a comprehensive view of prescription drug costs across multiple dimensions, related be the geographic, temporal, or payer-based. The interaction interactive, I guess. Nature allows users to explore the data and find insights relevant to a specific situation. Uh, For policymakers, researchers, and the dashboard reveals patterns in drug spending, regional costs, variations, the best insurance plan, and the variations with other countries, the total spending by region wise. In donut chart, they can compare with the scatter matrix with the PCP. Also, this can inform discussions about the drug pricing reform and the Medicare Part D optimization. I think they should really work on the Medicare providing these plans. And the most actionable takeaway for patients is the importance of comparing insurance plans during open enrollment periods. The difference like between the best and the worst plans can represent significant annual savings, and the dashboard makes this comparison straightforward, right? So that's it from me. Thank you for your attention. I guess I'll end this here.